Hi all, Dr. Raman Sakhuja here, consultant psychiatrist and an honorary professor of psychiatry with the University of South Wales. So in today's topic, what we are going to talk about is the difference between mental health and mental illness. So this is a common thing that people ask and perhaps explore on the internet as well. So let's try and clarify and first of all understand what mental health means, and then look at what mental illness is. So if we look at mental health, now mental health is a state of mental well-being where an individual is able to realize their full potentials and abilities so that they are able to go through life, the trials and tribulations of life, work to their potential, take on and fulfill all the responsibilities that they are given throughout their life roles that they have, and then positively contribute to the community. And good mental health depends on a number of factors, and I'm just going to name a few. So good mental health can depend upon genetics, how someone is brought up and their bringing up environment, how they are committed to their physical and lifestyle choices, what their personality is, that is, how do they think, feel, act, what are their core values, and lastly, one important aspect is how do they look after brain as an important organ of the body. We talk about looking after our liver, we talk about looking after our lungs, about our heart, but we have to start thinking about brain as a individual organ. I will be covering that aspect in the next video. But overall, mental health depends on a range of these conditions. So any of these problems in this may result in mental health problem. Now, if we know what is mental health, I'm making videos on this channel to give you, educate you and inform you about the common mental health topics and tips to manage them. Let us now talk about what mental illness is. So, when we talk of mental illness, we are talking about mental health problems that lead an individual to suffer in their quality of life, or that these problems are severe enough to lead to day-to-day dysfunctions in their roles and responsibilities of life, which is when we start thinking about these things as being mental illness. Now, mental illness can be of different severity, from mild all the way to severe. The treatment for mental illnesses are multifocal, and they often depend on the severity. Often, mild mental illness problems can be modified by lifestyle changes or by talking therapies or by self-help. Moderate severity may often require a combination of the above, but more structured psychological interventions, plus minus the need for medications. But for severe mental illnesses, often medications, neuromodulation, or other interventions from the biological perspective are needed before we consider the other talking therapies or other kind of changes that are required. So next time, if you're thinking about mental health, think about mental health as a state of well-being. And if we are talking about mental illnesses, then we start talking about the quality of life and the dysfunctions that an individual gets because of such problems. And if any of you, your friends, your family are suffering with any of these problems, it is far better to go and see a qualified professional who would be able to sift through your problems and direct you and treat you, formulate a plan with you depending on the severity of those conditions, and give you a sensible approach to manage those. Now, if you have liked and found this video useful, please press the like button, subscribe to the channel, comment on these videos, share it. Don't forget to press that bell button icon, because that way you will get notified for all the upcoming videos on this channel. Thank you very much for continuing to engage with me and watch this video right till the end.